My name is Isabella Viskupova, and I'm the founder of the Gentle Trauma Release Institute. In this class, we're talking about chronic pain. Pain in any circumstance is bad enough, but experiencing chronic pain is pure agony. The number of people suffering from chronic pain worldwide is staggering. In fact, many experts talk about chronic pain epidemic. And while not all chronic pain can be boiled down to emotional trauma, there's certainly a portion of cases that can be resolved with dealing with traumatic events from your client's past. Let's begin. Chronic pain is the kind of pain that persists over months or years. The official definition of chronic pain is pain that lasts for more than 3 months. Some definitions work with 6 months as a minimum duration requirement. However, this is just an arbitrary criterion. Chronic pain is really any pain extending beyond what is normally considered usual recovery timeframe, or time that we can reasonably expect in order for someone to heal and recover. Chronic pain can be both pain that's always present, but to different degrees, or it can come and go over time, but without getting resolved in the long run. A common byproduct of chronic pain is that it significantly interferes with a person's usual activities in a negative way, be it personally or professionally, or both. In other words, chronic pain undermines their work performance, or their ability to work altogether, their social life, their ability to take care of people who depend on them, as well as of themselves. For example, it affects their sleep, their eating, walking. In a nutshell, chronic pain adversely affects one's quality of life. Chronic pain is an integral part of some medical diagnoses, such as arthritis or neuropathy. But in this case, when chronic pain is part of a particular diagnosis, the cause of the pain is not a mystery. Say in neuropathy, the cause would be damage to one or more nerves. In many cases, however, the cause of chronic pain is not clear or cannot be found altogether. Chronic pain can also be a symptom, a physical symptom of emotional trauma. Having said that, when working with a client, we don't automatically assume that this is the case. We always explore it as a possibility. As a rule of thumb, chronic pain is often a result of trauma, emotional trauma, when the following conditions are in place. There's no medical or anatomical reason for the pain. So there's no history of injury. The doctors cannot find the cause of the pain. The MRIs, the CAT scans, the X-rays don't show any issue at all. In other words, there's constant pain for no obvious reason. There's no tissue damage or structural damage. Number 2, there's a lack of response to usual treatment options, meaning physiotherapy, massage, specific exercises that target pain or range of movement, or medication. So the person goes from treatment to treatment, from physical therapy to massage, and there's no or very little improvement. Even if the pain is managed through pain medication, it becomes less and less responsive to it over time. This lack of reason for the pain, combined with the usual treatment options not working, leave people with chronic pain in a state of confusion and despair, and understandably so, because not knowing why they're hurting makes it almost impossible to make the pain stop or to know if it ever will stop. The third requirement that we want to have in place in order to entertain the possibility that chronic pain might be trauma-related is the presence of unresolved trauma from the past. Now, this doesn't mean that the person has to know which events, which trauma specifically are at the root of their chronic pain, but the simple fact that there was trauma or traumatic events that were potentially traumatizing is enough. There is plenty of scientific evidence showing a link between chronic pain and trauma. Mostly PTSD has been researched. However, chronic pain is not officially a diagnostic criterion for PTSD. Said differently, there's a good amount of people who meet the diagnostic criteria for PTSD, and they also suffer from chronic pain. Note that chronic pain in and of itself can be, number one, the result of trauma. In other words, a physical expression, a physical symptom of trauma. But it's also a textbook example of a cause for future trauma, a root of future trauma, if you will. And this is because chronic pain carries the characteristic features of trauma, which is threat, in this case, constant physical pain, coupled with inescapability. You have no idea when or if the pain will end. I do want to highlight here that we're by no means saying that all chronic pain is the result of emotional trauma. What we are saying is that a portion of chronic pain cases does respond well to addressing and resolving emotional trauma and releasing it from the body, in that the pain either goes away completely or is significantly diminished. The way to go about this is to first and foremost explore and investigate with the client if their pain could be trauma-related. We want to do this within the history-taking process in the session. And if we see that the 3 criteria that we just went through are there, they're in place, then we can conclude that there's a likelihood that the client's chronic pain might be trauma-related. So just to repeat, there's no medical or anatomical reason for their pain. They don't respond to usual treatment options, and there is at least some history of trauma in their past. Where do we go from here? The main working principle behind chronic pain elimination and mitigation in the GTR method is that there is a specific traumatic event or events behind a person's pain. In other words, the physical pain, say lower back pain, is a symptom of trauma. The aftermath of a traumatic event or several traumatic events from the client's past. And we want to realize here that the traumatic event doesn't have to be an event where there actually was physical injury. For instance, if someone suffers from chronic pain today, the traumatic event that is causing it doesn't have to be a car accident that caused the lower back pain or whatever chronic pain the person is suffering from today. It could be an event that had to do with betrayal or emotional abuse, not physical abuse that could have technically caused an injury leading to today's chronic pain. To say it in simple English, a painful breakup 10 years ago could be the source of chronic neck pain today. Sometimes the client doesn't know exactly which one out of the many traumatic events that they went through is behind their chronic pain, and that's perfectly okay. For instance, in the GTR method, we have a process called the Emotional Freedom Plan that we use to help the client and identify the likely quote-unquote candidates, that is, events from their past that could have potentially traumatized them and caused that pain. And then we tackle those events. They traumatize those traumatic memories. Also, often people are so used to living with their chronic pain that it doesn't even cross their mind that it could be trauma-related. And they only realize it after doing some GTR work, when after clearing traumatic events from their past, their pain goes away all of a sudden. this is actually quite common. Chronic pain is such a given in many people's lives that they don't even mention it as a challenge or an issue during the history taking process. They might mention other challenges such as anxiety, sleep issues, difficulty speaking up for themselves, lack of trust in others, you name it. But often it doesn't occur to them that their pain could be a symptom of traumatic events from their past. What we see often is that the client begins de traumatizing, targeting the traumatic events relating to the symptoms that they are aware of, such as that anxiety, those sleep issues, that difficulty speaking up for themselves. And as these symptoms go away, they also notice that so did their chronic pain. When it comes to short-term reduction in pain, we see this in the sessions almost always. This can be reduction in acute pain. For instance, the client's head has been hurting the whole day and it's not chronic pain, and the pain stops in the session. Or the chronic pain itself is reduced in the session, or it goes away in the session, but we don't know yet if it's going to last. This could be potentially due to reducing the current stress levels. In other words, the stress that's going on for the client now was dissolved in the session, and thus the pain was reduced as well. But as much as helping someone to eliminate or reduce any kind of physical pain is deeply satisfying, when it comes to witnessing how your client's chronic pain was dissolved or greatly reduced, it's like nothing else.